Hello, everyone, and welcome to the OEB 2024-25 Plan Year. Open Enrollment is Here webinar. Thank you for joining us. Today, we are going to talk about a few things, but before we get started, I wanted to share some webinar tips, a few little housekeeping tips. So during the presentation, please feel free to type in questions anytime that you might have for OEB or our carriers. Questions will be answered at the end of the presentation. And we will have closed captioning available next week with our YouTube recording. You'll receive a follow-up email when the recording is available. And we also have additional videos, slides, and flyers at oebinfo.com. So please be sure to go there and check out the items that we have. If you have a question, you can click the question mark icon in the menu and then type in your question. So for our agenda today, we're going to hear from OEB with overview and highlights for open enrollment this year. We're going to hear from our new EAP vendor, Canopy. We'll hear from Kaiser Permanente about medical, dental, and vision plans. We'll hear from Moda Health, medical, dental, vision. Willamette Dental Group for dental, VSP for vision, the Standard for life and accident and disability. And then at the end, we'll have some final question answers and wrap up. We'll go ahead and get started. So we'll talk about our overview and highlights for the 2024-25 open enrollment. So open enrollment for OEB is August 15th through September 15th for most employers. Do be sure to confirm with your employer your deadline. And please remember that open enrollment is the one time each year you can make changes to your plans or dependents without a qualified status change. However, this year we are having a passive open enrollment, and that means that it is non-mandatory. So we have some scenarios on the next slide to see if you need to complete open enrollment this year. Okay, so if you're satisfied with your current benefit plan selections, you don't need to do anything. Your current enrollments will roll over automatically to the next plan year and your benefits will stay the same. If you want to make benefit changes, then you'll need to log into oebenroll.com and make your selections during open enrollment. This includes enrolling as a new hire, replacing a plan that is no longer offered by your employer. If you want to change your plan selections, add or drop a dependent, and then you can also go in there and update personal information, change your surcharge answers, or change or add beneficiaries. Now, if your employer requires you to enroll, then you must log in to oebenroll.com during that enrollment time period and follow your employer's instructions. We do have some open enrollment communications that you should be receiving in the mail, and then also we have posted on the website. So we have the open enrollment letters. These were mailed out August 1st. You should be receiving them or have already received it. It's a standard letter size envelope with red font from OEB. This personalized letter includes the list of plans available to you, links to resources to help you choose your benefits, and then other important enrollment information. We also have the enrollment guide is posted at oebinfo.com, and in there you'll have more detailed information about your benefits and what's changing and staying the same for this year. We also have some really cool benefit education tools that we would love for you to check out. We have Explore Your Benefits. This makes learning about your OEB benefits fun. It's kind of a gamified interactive learning tool that has, it is award winning. We submitted it to some competitions and won awards of excellence. So we're really proud of it and would really love it if you would go check it out. It's at oebexploreyourbenefits.com. 2025. We also have the online plan comparison tool, and this is a tool that you can use to see online the medical, dental, and vision plans side by side. You can customize it by selecting the different services that you want to see or taking out different plans. You can look at it just by dental, just vision, and then once you have it customized the way you want, you can print it out and then you have your own customized comparison. So if you go to compareoebplans.com, you can use that cool tool. Okay, so now we can talk about what's new for 2024-25. And please note, all changes that we are talking about here will be effective October 1st, 2024. So the board has worked very hard to offer new services while keeping plans affordable. So for medical, dental, and vision plans, for the upcoming plan year, we will offer the same medical, dental, vision options. And OEB will continue to offer plans through Moda Health, Kaiser Permanente, Delta Dental, Willamette Dental Group, and VSP. And so check your personalized open enrollment letter to see the plan options that are available to you. Let's see, costs. So your premiums may change. So your employer will provide your 2024-25 premium amounts. We have an update to eligibility and new babies. So your new baby receives coverage through your medical plan for the first 31 days of life, and you pay no premiums during this 31-day period. Your new baby must be enrolled within 60 days of their birth date, and premiums will start on the first of the month following birth. For all medical plans, we are very excited about this new offering. We're offering doula services for all medical plans. 8 prenatal and or postnatal visits plus delivery are covered, and we'll be hearing from each medical plan carrier, and they can tell you more about their plans and details. I'm going to hit the highlights here and let them be the experts on their content. So for Moda Health medical plans, they are adding Teladoc as a virtual primary care visit option. They're adding Mighty Health, which is an alternative weight management program, and Gabby, which is a breast cancer risk assessment program. For Kaiser Permanente medical plans, they're adding Omada, an alternative weight management program. For Plan 1, Plan 2A, and Plan 2B, there will be some changes to the copays for specialty scans. We will have a separate prescription drug out-of-pocket maximum will be removed. The prescription drug cost will increase, and emergency department copays will increase for Plan 1 only. For the Kaiser Permanente dental plan, the lifetime limit on dental implants will be removed, and increased medical coinsurance for custom occlusal night guard and athletic mouth guards. And this is one we're really excited about, our new EAP through Canopy. And then remembering this is beginning October 1st. There will be free confidential counseling and support will be provided through Canopy if your employer offers the EAP. And if they do, then your Canopy benefits will automatically be available to you on October 1st. The EAP is free to members if offered by your employer. For the optional benefit plans, OEB will continue to offer optional benefit plans to help you prepare for life's important moments. There are no rate changes in the upcoming year for disability insurance, life insurance, AD&D, and long-term care insurance. And you can see the plans that are offered below. So we have everything everything you need online anytime. If you visit oebinfo.com, you can find all of the enrollment listed there. Into the My OEB system anytime at oebenroll.com and complete your open enrollment if you need to. Member Services is here to help. I have the phone number here, and they are going to be open Monday through Friday, available 8 a.m. to 5 p.m., closed weekends and holidays. This does include Labor Day. You can always send an email to OEB Benefits. And we do have interpreters available because it's during open enrollment and things are a bit busy. If you need an interpreter, please email the address here so we can set up an appointment. And now we will start with the carrier presentations. And so the first one that we're going to hear from is Kelsey at Canopy. So I'm handing that over to Kelsey.
Perfect. Thank you so much, Sarah. Can you just confirm that you can see my slide?
I can. Looks great.
Excellent. So hi, everyone. My name is Kelsey Nordland. I'm a customer success manager with Canopy, your new enhanced employee assistance program, also known as an EAP. I'm going to provide an overview of the many benefits you'll have through Canopy starting October 1st. As they mentioned at the beginning, there will be time for questions at the end, and you're welcome to type them into the chat. Starting October 1st, so in a little over 1 month, all employees will have access to Canopy. The benefits that I review today will also be available to your spouse, domestic partner, family members living in your household, and dependents up to 26 years old, regardless of location. Canopy is a free and confidential benefit. Your entity actually pays for the benefit, which is what makes it free to you and your family members. And it's confidential, so your supervisor or HR won't know when you're accessing services. This slide here is the service summary, listing most of the benefits that you'll have available through Canopy, starting with access to in-the-moment phone counseling 24/7, 365. You're also going to have up to 8 free counseling sessions. For counseling, we can match you with a counselor based on a variety of preferences, such as in-person or virtual appointments, language, ethnicity, age range, medical insurance, etc. In addition to the 8 counseling sessions, you'll also receive 8 coaching sessions. For coaching, members can utilize those to set personal goals, make a plan, and receive encouragement to follow through on those plans. Canopy also offers anonymous virtual peer support. This is available 24/7, 365 as well. With this, you can browse resources, read interactive discussions without participating in them, or you can join in chats with people sharing similar struggles in a safe space moderated by clinicians. Quite a few benefits under the resources for life, such as childcare and adult care support. The same consultants that do the childcare and adult care searches can do a resource retrieval. You'll have unlimited financial coaching, legal referrals. This includes a free 30-minute legal consult on up to 3 different topics per year. If you do need to hire an attorney, it's a 25% discount on services thereafter. Identity theft services, fertility, health, and family building support, a home ownership program. The home ownership program is for people wanting to buy, sell, or refinance a home. We can also do a resource retrieval if you need immediate short-term housing or want to move into a different rental. And you'll have access to gym and pet insurance discounts as well. I'm going to review the member site and digital tools a little bit more in a couple slides. Speed to care, there's a variety of ways that you can access services through us. You can call, email, go to our app or our member site. If you do call us, you'll reach a live person in about 10 seconds. A couple other things for speed to care. If you're accessing counseling through Canopy, we monitor the referral in our system to ensure a connection between the counselor and the member. If we don't see an appointment scheduled after 2 business days, we'll follow up with the provider. And after 3 business days, we'll also follow up with the member. Right now, most members have their first appointment in about 1 week, which is amazing. And then for coaching, we can get people scheduled in as quickly as 1 to 2 business days. Our member site is the hub of your Canopy EAP benefits. You can request services and search for counselors here. There's also countless resources, webinars, articles, courses, and more broken down by topic. So again, starting October 1st, you can access this at the my.canopywell.com, and you'll register under company name OEB. Our Canopy EAP app is, of course, free and confidential as well. Similarly here, starting October 1st, you can search Canopy EAP in the Apple Store or Google Play, and you'll register under company name OEB. What's next? So we're very excited to offer a couple deep dive orientations specifically for employees. We'll go into a lot more detail about all the benefits you and your family members will have through Canopy. This slide deck is going to be posted on OEB's website, so you can access these registration links there. As you can see, there's a couple options. We've got September 26th at noon or October 8th at 4 p.m., depending which one works best for you. If you have questions, again, you can type them into the chat, or you can call or email Canopy anytime. Thank you all so much. Thrilled to work with you, and we hope to see you at one of Canopy's deep dive orientations September 26th or October 8th. Take care.
Thank you so much, Kelsey. And now we will move to Kaiser Permanente, and let's see, that is Ophelia.
Yeah.
Can everyone see the screen? Ophelia, can you see?
Yeah, I can see it. It's on slide 6 right now.
Oh, sorry.
That's okay.
Oh, there we go. Sorry about that.
No worries. All right. Thank you. Thank you, Sarah. So hello and welcome. My name is Ophelia McMenemy, and I'm a Senior Engagement Specialist with Kaiser Permanente. So today I'm going to give you a brief overview of our medical care and coverage and describe the different Kaiser Permanente plans available to OEB members as of October 1st. But before we begin, here are a few reminders. Kaiser Permanente is an integrated health system, which means we provide care and coverage with many services under one roof. When you become a Kaiser Permanente member, your doctors, specialists, and health plan are all part of one connected team, coordinating your care so you don't have to. And if you're switching to us from a non-Kaiser Permanente plan, you will need to select a new provider from our network. Okay, next slide. So Kaiser Permanente members have more ways to get quality care than ever before. We continue to offer same day, next day, after hours, and weekend services at many of our locations. So when you need care, you can visit kp.org or use the mobile app to schedule in-person video or phone appointments. You can message your doctor with non-urgent questions and get a reply usually within 2 business days. And then through our Get Care Now model, our KP clinicians are available 24/7 for urgent care needs via video and phone. No appointment is necessary. You can continue to get support 24/7 with an advice nurse. Via phone, with e-visits, you can complete an online questionnaire and receive a treatment plan and prescriptions if needed within a few hours. And then as a reminder, no referral is needed for mental health care. You do have direct booking options on kp.org or the mobile app, and an open directory of affiliated providers. Next slide. We continue to have the same plan options available for OEB members for the 2024-2025 plan year. Plan 1 has the highest premium of our plans, but members pay lower cost shares when they need services. This plan offers predictable costs with no deductible and simple copay features. Plans 2A and 2B offer lower premiums than Plan 1, while still providing simple copays for primary and specialty care office visits. These plans do have a deductible and coinsurance for major services. So common examples will be of major services is emergency room, hospitalization, and outpatient surgery. And Plan 3 is the only Kaiser Permanente plan that can be paired with a health savings account or a health reimbursement account. This plan has the lowest premium of our plans, but the highest cost shares when members use services. To moderate the premium increase this year, we did make the following benefit changes effective October 1st. Emergency department copay for Plan 1 will increase by $50. Specialty scans such as MRI, CT, and PET scans will increase by $50 on Plans 1, 2A, and 2B. Prescription drug copays will increase by $5 for all non-specialty medications, but the specialty drug cap will also increase by $50. And then prescription drug copays will no longer have a separate out-of-pocket maximum. The prescription copays will now accumulate towards the medical out-of-pocket maximum. Next slide. We have added the following new benefits for the 2024-2025 plan year. So doula coverage. You get 8 visits plus birth. Typical services by a doula would include 2 to 4 prenatal visits, 24/7 on-call services starting at 37 weeks, in-home early labor support, and they'll help you to make the right determination of when to go to the hospital, hands-on comfort techniques during active labor and advocacy as needed. They can provide breaks for your partner, photos of the day your baby is born, immediate postpartum and lactation support after birth, and then 1 to 2 postpartum visits, whether in person or virtual, for birth processing and answering postpartum and newborn questions. And then we also added OMADA for weight management, which is a virtual program that makes it easier to lose weight and improve your health. With tools that provide real-time feedback and expert guidance from a personal health coach, you'll learn simple changes over time and at your own pace. So you can use this program as long as you need it, and on average, the participation takes like 1 to 2 hours per week. The age criteria for this program is you must be 18 and over. Next slide. I think we missed one. Diabetes. Well, I'll just talk about it. We also have OMADA Online Diabetes Prevention Program, which is an approach to show that reduced risk factors for type 2 diabetes and heart disease. The program elements for that one will include smart tools and technology as a pre-connected scale, supportive online peer groups, interactive lessons, and a professional health coach for the entirety of the program. But you must note that the members must meet clinical inclusion criteria to participate in that program. Okay, so let's talk about self-care apps. So with Kaiser Permanente, our members have access to powerful wellness apps that can help you navigate through life's challenges, including making small changes to improve your sleep, mood, relationships, and more. The first app here is Calm, which uses meditation and mindfulness. This is available at no additional cost. And, you know, this app offers something for everyone, such as guided meditations, tales, music, and calm masterclasses taught by renowned experts and celebrities. And then we also have Headspace Care, which is text-based, and you have access to on-demand emotional support coaching. You can text with a coach anytime, anywhere for one-on-one support, and you can use this app for 90 days a year at no additional cost. And then ClassPass, our members can have access to over 4,000 on-demand fitness classes online, including cardio, strength training, and yoga. And then you can also get reduced rates on live streams and in-person fitness classes. I apologize for the background noise. And got a benefits fair. I'm hiding in a room. Okay, so I'll talk a little bit about our vision care. Let's go ahead and skip this one if you don't mind. And that one. I guess it was later on in the, there we go. So let's talk about vision coverage. So eye care services are integrated with our medical benefits. So to take part in our vision plan, you must have a Kaiser Permanente medical plan. Okay, next slide. So there are no changes to your vision benefit for the 2024-2025 plan year. We do offer comprehensive vision exams as well as a $250 credit for glasses or contact lenses. OEBB members can also use $100 of their annual $250 hardware allowance to purchase non-prescription sunglasses or digital eye strain computer glasses. And we also offer the 50/50 protection plan, and members can also save 30% on the second complete set of eyeglasses. Next slide. And then we have 6 convenient Vision Essential locations in the area, spanning from Longview, Washington to Salem, Oregon. And then our members in the Eugene Springfield service area have access to affiliated provider vision clinics there. So you can visit kp2020.org to find a location near you. Next. So let's talk about dental care. OEBB members do not need to choose a Kaiser Permanente medical plan in order to choose a Kaiser Permanente dental plan. However, when a member does have care and coverage for both medical and dental through Kaiser, they'll get the benefits of our uniquely integrated system, making it easier to get the care you need. Next slide. So here we can see how our dental plan adds value. We combine KP medical and dental, and that lets our members experience our unique approach to care that is coordinated. It allows our teams to work together and focus on not just members' oral health, but also the total health. So our dental care team can support members beyond their oral health needs, such as addressing preventive medical care, diabetes care management, tobacco cessation, and cancer screenings. So this level of integration is built in it and included in our dental plans at no additional cost. Next slide. There is no deductible for the Kaiser Permanente dental plan. Each time a member comes in, you'll pay $20 office visit copay. This office visit copay is waived for preventive services. The office visit copay will cover the cost of most basic services, but members will have some additional cost on restorative and major services such as root canals, crowns, bridges, implants, and orthodontia treatment, as seen on screen. The following are the benefit changes effective October 1st. We've removed the lifetime limit on implants. The cost of implants is now subject to the annual benefit maximum. We increased the co-insurance Aquacel and athletic mouth guards from 10% to 35%. And also, there is no longer a 12-month waiting period for dental benefits. Next slide. So with 31 medical offices, 9 Salud en Español clinics, 21 dental offices, and 2 hospitals, we provide convenient access to healthcare services throughout the Northwest region. Additionally, our partnerships with affiliates from Longview, Kelso, down through Lane County further extend the reach of our healthcare network. So as of August 3rd, Kaiser Permanente members in Lane County can receive primary care at any Peace Health location. So also, please note that not all OEBB members have access to our plan because it's only available in certain areas. So if you do have questions about the availability, please contact your benefit representative. Next. And so here, we're here to support you while you navigate the process of choosing a health plan. So we have office hours here where we have a dedicated one-on-one phone appointment with a Kaiser representative that can ensure that you get assistance on questions regarding plan offerings and care transitions. There's also the new member welcome desk that can assist in transferring prescriptions and medical records and also answering other questions. And then for our members in Lane County, we've created a dedicated member support line so members can get personalized help with referrals, billing appointments, and more via phone. When it's busy or after hours, the call will be answered by call center staff trained specifically in Lane County member service support. And last, we do have a dedicated website for OEBB employees. This has a lot of information such as benefits, what we kind of went over, links, and then we have created videos that focus more in depth on the medical, dental, and vision benefits, understand Lane County, understanding our Plan 3 HSA compatible plan, and more understanding on alternative care, member discounts, and more. If you have questions about your premium costs or plan options, please talk to your employer. So we hope you found this presentation helpful. It was very brief, but again, if you visit our website that you see on screen, you can find a lot more information and more detailed videos. It's our privilege to be of service. If you are a new KP member, we welcome you, and if you're a current Kaiser member, we are your biggest fans, and thank you for choosing us as your healthcare coverage and care.
Thank you, Ophelia. And now we will move to Moda Health, and we will hear from Alina.
Great, perfect. Let me share my screen. All right.
Looks great.
Perfect. Well, hello, my name is Alina Rabitzi. I'm the Senior Account Executive with Moda for OEBB. So today I'll briefly provide a high-level overview of our medical, dental, and vision plan for the 2024-25 open enrollment. So first we'll start with medical and pharmacy. Moto will continue to offer all 7 plans, medical plans. Please check with your employer to see what plans they are offering you as an employee, because each employer can offer different plans. There are no plan design changes to the deductibles, out-of-pocket maximums, co-pays, or co-insurances from last year. That all remain the same. With our plans, you have the option to participate in coordinated care or non-coordinated care. By participating in coordinated care, you must select a PCP 360 for primary care services to receive better benefits. So a PCP 360 is just the primary care provider that you see for your annual checkup. This is the doctor that you would see if you're sick. And then you would get the better benefits of a lower individual deductible, a lower out-of-pocket maximum, co-pays with your deductible waive for, primary care, specialist care, or alternative care. So for example, if you are on plan 1, you selected a PCP 360 for primary care services, you now have a $400 deductible instead of a $500 deductible. You have a $2,850 out-of-pocket instead of a $3,250 out-of-pocket maximum. Every time you see that PCP 360 or anybody in that clinic, it's just a $20 copay with your deductible waive. Every time you see a specialist, it's just $40 copay with your deductible waive. If you were to get acupuncture or spinal manipulation, it's just a $40 copay with your deductible waive. Please keep in mind that 6 and 7 are your high deductible health plans, meaning you can attach a health savings account with that. With a health savings account and a high deductible health plan, you have to meet your deductible first before insurance kicks anything. So if you're on plan 7, you would have to meet that $2,000 deductible before an 80-20 split coinsurance would apply. Members who live outside the service area, so dependents who live part-time outside the Connexus service area, like college students, can still choose a PCP 360 for coordinated care and receive those better benefits. We do ask that you, as the employee, update your dependent's address in the My OEBB system, because that will let us know the correct network to move that dependent in. So dependents living outside the Connexus service area will utilize Moto's national network and a PPO to receive in-network benefits away from home, except for members living in Alaska or Idaho. If you live in Idaho, you'll use our Connexus network, and First Health. Members in Alaska will use our First Health network. New this year, for those who live full-time outside the Connexus area, so Oregon, Southwest Washington, Idaho, you are able to participate in coordinated care and receive those better benefits through our Teladoc primary care program, which I'll explain in just a little bit. So some plan enhancements starting 10/1 for our Moto plans is that nutritional therapy is now available to all members at the standard cost sharing without a required diagnosis or prior authorization. So before, members might either need an eating disorder or diabetes for nutritional therapy to be covered, but starting 10/1, it'll be available to all members. Also effective 10/1 is that doula services are now covered up to 8 visits plus birth and delivery at no cost to you. So as Kaiser Permanente mentioned, this is during, you could have support, doula support during your prenatal and postnatal visit and the time of your birth and delivery. Starting January 1st, 2025, Moto will be changing the PCP 360 selection to be at the clinic level rather than the individual provider level. So if you currently today have a PCP 360 provider selected, you will automatically be assigned to a PCP 360 clinic. And you do not have to do anything. We'll send you a letter just to let you know that you've been assigned to that clinic. So starting 10/1/2024, Teladoc will be added. Is a virtual primary care program designed to help you gain access to coordinated care and a primary care provider in a virtual setting. So with Teladoc, you can schedule an appointment by using their app, desktop, or phone. But prior to your first virtual appointment, Teladoc is actually going to provide you a blood pressure cuff and a heart rate monitor, so you can take your vitals at the time of your appointment. If labs or specialists are required, the teledoc provider will then help coordinate these visits. So they'll provide you, help you set up those appointments with an in-network provider. You'll be able to access teledoc through your member dashboard, or you can visit their website, teledochealth.com. So again, as I mentioned earlier, you can select teledoc as your PCP 360 and start to receive those better benefits. Teledoc's virtual primary care program is subject to the virtual visit cost share, while other treatment services will be subject to the standard cost sharing. Also effective 10/1/24 is OEBB's adding Mighty Health, which is a first virtual care platform focused specifically on helping adults lose weight, reduce pain, and improve mobility and function. So with Mighty Health, they provide initial and weekly assessments. It's a physician supervised lifestyle modification plan. They do it in bite-sized interactive lessons created by a leading clinician. They have occupational therapy driven exercise routine that includes chair yoga, low impact aerobics, and that's all available live through Zoom or on demand. But with the program, what they do is they culturally tailor nutrition plan to help you achieve a healthy weight. So that can include helping you customize a grocery list, finding different recipes, and also assist you with food journaling with feedback from a health coach. And then they also provide cooking classes. Mighty Health will be available to you at no cost. Again, you can access Mighty through your member dashboard or visit this link you see here. Also effective 10/1 is Gabby, which provides a digital breast cancer risk assessment. So with Gabby, they have an app that you're able to take a risk assessment to ensure all women know their risks and have early detection for breast cancer. So depending on your risk score, Gabby is going to help you determine the level of care needed. So if you're at high risk for breast cancer, their clinical team will work with you to prescribe the right care at the right time. So meaning if you were high risk, they may recommend that you get a mammogram with a specialist, so they'll help you schedule that appointment with that provider. Gabby's risk assessment and concierge service is available to you at no cost. Also, you can access Gabby through your member dashboard or the link here. So some pharmacy benefits. There are no changes to our pharmacy. Medical plans 1 through 5 are broken out here by retail, mill, and specialty. But you're probably wondering, how do I know my prescription falls under what tier? On our website, we do post our prescription formulary of all the drugs that are covered with the MODA plans. If you enter your drug name, it will tell you where tier it falls under. So if it said select generic, you know it's a $12 per 31-day supply. Again, plans in 7 are your high deductible health plan, meaning you have to meet your deductible first before insurance pays for anything. That includes your pharmacy, unless it's a value tier drug. So if you're normally paying $300 for that prescription, you'll be paying that amount until you meet your deductible. Okay, moving on, as a MODA member, you have access to our Behavioral Health 360 program. So with our Behavioral Health 360 program, you have access to our Behavioral Health Champions and self-guided assessment. With our Behavioral Health Champions, they can help you find mental health professionals that are right for you. So what we know today is that members are having to call 10 to 20 different therapists just to find availability. And so with that, you can call the Behavioral Health Champions. They're actually going to call those providers for you and find the quickest availability. After your first appointment, that Behavioral Health Champion is going to follow up with you a week later just to check in to see how that appointment went. Because what we know today is that some members don't feel comfortable sharing their situations with a therapist because they don't connect with them morally or culturally. And so if that's the case, that Behavioral Health Champions will start that process all over again and help you help find you a provider. Also, in your member dashboard, we have a self-guided assessment that you can take on your own time. It'll ask you a series of questions, and depending on how you answer, it will recommend the different types of resources available to you. MODA has partnered with Spring Health to give you access to behavioral health telehealth service via your phone, tablet, or computer. That includes mental health therapy, psychiatry, care navigation, and digital cognitive behavioral therapy. Again, this is in your member dashboard. Here, we do have an app for your member dashboard, so you can download the MODA 360 app. You would create your account. This is all of your information where you can download your ID card, check your explanation of benefits. All the different types of resources that I just went over would be in your member dashboard, which is customized to you. Now, moving on to our dental plan. MODA will continue to offer plans 1, 5, 6, the exclusive PPO incentive plan, and the exclusive PPO. There are no changes from last year, so that all remains the same. Plan 1, 5, and 6 uses our Premier Network. The exclusive PPO incentive plan and the exclusive PPO plan uses our PPO network. Please keep in mind, plans 1 and 5 in the exclusive PPO incentive plan are your incentive level plans, meaning they start at a certain percentage. For example, plan 1 for cleanings, implants, crowns, fillings, they all start at 70%. As long as you see the dentist once a year, your incentive level will increase by 10%. So hopefully by your 4th year on that plan, those services are now covered at 100% up to your benefit maximum of $2,200. Say you forget to see the dentist one year, your incentive level will decrease by 10%, but no lower where than you started. Please keep in mind that if you transfer from one incentive plan to another incentive plan, your incentive level will transfer. With our exclusive PPO plan, please keep in mind there's no out-of-network benefits, meaning that you will need to see a PPO provider to receive any benefits. With OEBB, members have the preventive first benefit. That means preventive services do not accrue towards that annual benefit maximum, leaving those additional dollars to use for basic and major services like fillings and crowns. As a Delta Dental OEBB member, you have access to our Health Through Oral Wellness program. So what that does, providers participating in the program use an oral health assessment to find out the member's risk of tooth decay, gum disease, and oral cancer. Depending on your risk score, you may qualify for additional cleanings, fluoride treatment, sealants, periodontal maintenance, and nutritional counseling. To see if your provider is participating, just see if they have that green badge you see here. Now, moving on to vision. There are no changes to our vision plans. We still offer Opal, Pearl, and Quartz. There's a $6,000 benefit maximum for Opal. Pearl is $400, Quartz is $250. All the plans work the same way, it just has a different benefit maximum. So eye exam, lenses, and frames are all covered at 100% up to your benefit maximum. So keep in mind that you can see any licensed ophthalmologist, optometrist, or optician, but we do have MODA contracted vision providers in our Connexus network. What that means is that we were able to negotiate a discounted rate for you, but you can see anybody. People like to go to Walmart or Costco because it's cheaper, but sometimes they don't bill insurance. And so you as the member would have to pay up front for those services, then submit a reimbursement claims form to get reimbursed for those services. Again, the annual maximum includes vision exam and hardware. Please keep in mind that you do have access to our Health Navigator team. They're available Monday through Friday, 7:30 to 5:30. There's the phone number. You can email them, or you can instantly chat with the Health Navigator through your member dashboard. Thank you so much.
Thank you, Elena. And now we will switch over to Willamette Dental Group and Tiffany. Take it away.
Thank you. Let me go ahead and share my screen. All right, can you see that okay? All right, great. So good afternoon. My name is Tiffany Nicholson, and I'm excited to share our 2024-2025 Plan Your Information with you today. No changes this year. All the benefits remain in place. We do have one benefit enhancement that's going to continue this year. If you're a new patient and you've never seen a Willamette dental provider before, the office visit copay will be waived for that new patient appointment, and we'll talk about that a little bit later. Willamette Dental has nearly 50 dental office locations across Oregon, Washington, and Idaho. All of our offices offer general dental care, and then specialty care is available in about 3/4 of our offices. Our offices are open Monday through Friday, 7 a.m. to 5:30 p.m. and select Saturdays. Appointment availability is extremely important to our patients and also the long-term success of our dental practice. Current average access times for Oregon, which includes Southwest Washington, is 24 days for 2024 year to date, and our goal for access is within 30 days, depending on appointment type. This does exclude emergency appointments and specialty care. Emergency appointments, our goal is to get the patient in within 24 to 48 hours, and we have emergency triage available 24/7. Throughout this last year, we have had some select geographical areas with challenging appointment access. We have officially signed 5 new dentists in total, 2 for Eugene, one that started in just early August, and an additional one starting early September. 1 new dentist for Springfield, also starting early September, which is going to make us fully staffed for both of these offices. As these providers onboard, their schedules will become available, and we will start to see in a few weeks an increase in availability of appointments. We've also hired 2 new providers for Albany, both starting early fall as well. So Grants Pass, we are currently heavily recruiting for an open provider position, in which our 2 Medford dentists are each working and covering schedules at Grants Pass in the interim, and we will continue to do this until we hire for that open position in Grants Pass. So now to the specific benefits of the dental plan. There are no upcoming plan changes, as I mentioned. Just as a reminder, our plan includes no annual maximum, no deductible, and no waiting periods. So with Willamette, members have a copay per service, which is just that set dollar amount that the member is going to pay, and the insurance covers the remainder. So diagnostic, preventive, and basic services, which does include fillings and routine extractions, are covered with that general office visit copay of $20 per visit. As I mentioned in the beginning too, if you are a new patient, for OEBB members that have never been seen by a Willamette provider, that office visit copay, that $20 for that new patient appointment, will be waived. Major services have an additional copay on top of the office visit copay. So for example, if a member needed a crown, they would pay that $20 office visit copay each time they visit, in addition to the crown copay. So now let's talk about our outstanding dentists. All of our dentists practice evidence-based dentistry, and our evidence-based approach to treatment is going to focus on prevention and stopping the root cause of tooth decay and gum disease. So we use the most current dental science along with our dentist years of experience, and then your specific needs to create a treatment plan that's going to be right for you. So each patient at Willamette Dental gets a proactive dental care plan, which is a personal treatment plan for your current oral health. It's going to show risk for oral disease, an outline of treatment plan for in-office treatment, and then dentist recommendations for at-home care. How often your teeth are cleaned at Willamette may be different than what you're used to. So because we use the latest scientific evidence, cleaning frequency is also based on that evidence. So we use a personalized risk-based approach, which means some patients with gum disease may need a cleaning every 3, 4, or 6 months, while others with excellent at-home care may only need a cleaning once a year, which is completely safe and healthy. So cleaning frequencies will range from 1 to 4 cleanings per year as recommended by your dentist. So our patients tell a great story, and we've been posting the star ratings and comments for about the last 8 years onto our website. To help members choose a dentist that's going to be best for them, you can find biographies, photos, credentials, all available on our website, in addition to those star ratings and comments. So on average, all of our providers are rated over 4.5 out of 5 stars, and 9 out of 10 patients would highly recommend Willamette Dental to family and friends. So with Willamette Dental, you don't need an ID card. We don't issue any patient-specific information as we are an integrated model. So to make an appointment, all you need to do is give us a call and provide name and date of birth. Our goal is to make things easy and provide the best dental experience possible. If you do have questions, please feel free to enter them in the chat, or you can contact our member services team directly as well. Thanks so much for your time.
Thanks so much, Tiffany. And now we will move to VSP, and Chantel, take it away.
Perfect. Are you able to see the screen?
Yes, looks great.
Great. All right. Hello, everyone. My name is Chantel Gordon. I'm the Senior Account Manager at VSP for OEB. Thank you for taking the time to learn more about the vision benefits OEB is offering you in partnership with VSP Vision Care. With VSP, our goal is to help you see well and be well for a lifetime of good vision. Even if you have 20/20 vision, it's important to get an eye exam every year. A VSP Well Vision exam can reveal health conditions even if you don't have symptoms. OEB offers 2 VSP plans for you to choose from, the Choice Plus plan and the Choice plan. Offering both, it gives you the opportunity to choose the best plan for yourself and your family. Now what we're going to do is take a look at the great benefits available under both plans. These are the same Grade 2 plans VSP and OEB offered last year. Both plans cover a well vision exam in full every plan year after a $10 copay, and retinal screening is covered with an up to $39 copay. Prescription glasses are covered every plan year after a $20 copay, or members can choose contact lenses instead of glasses every plan year. The key differences in the plans is the Choice Plus plan includes a higher frame or contact lens allowance, fully covered impact-resistant lenses for adults, also premium or custom progressives, and it has anti-glare coating covered with just a $15 copay. With VSP Light Care, OEB members can choose ready-made non-prescription sunglasses or blue light filtering glasses instead of prescription glasses or contacts. With vision therapy, you get a fully covered evaluation and 75% off approved therapy sessions up to $750 annually. Vision therapy sessions cover diagnosis and treatment of turned eye, eye teaming, lazy eye focusing, and general eye movement ability. You're going to want to check with your doctor to make sure that you qualify. VSP members get access to exclusive member extras, up to $3,000 in savings on leading industry brands, plus OEB members get an additional $50 to spend on featured frame brands. And you can see those at vsp.com/offers to see more ways OEB members can save. With VSP, you have the freedom to choose the provider that works for your lifestyle. You'll have access to over 100,000 access points, including VSP network doctors, such as premier program locations where you can get the most out of your eye care experience, or you can choose from popular retail chain locations, or an online option with Iconic. And with Iconic, it is the only website that seamlessly connects VSP Vision benefits to a member's account. Iconic offers a variety of well-known brands and contact lenses, and you get to choose from over 70 eyewear brands and over 1,600 styles. While you'll maximize your benefits with a VSP Choice Network provider, you can go out of network. You may pay more in out-of-pocket expense and will be reimbursed based on a schedule of allowances that are listed there. Using your VSP benefit is easy. Create an account on oeb.vspforme.com to review benefit information and find an eye doctor who's right for you. Simply tell the doctor's office you have VSP when you make your appointment. There's no ID card needed or claim forms to complete when you see a VSP network doctor. Choose VSP for you and your family and give them the coverage and quality of care that they deserve. Listed on the screen, you can contact VSP directly at 800 number, or you can also take a look at the website, oeb.vspforme.com. Thank you.
Thank you, Chantel. And now we will switch over to David at the Standard. David, if you're talking, I'm not able to hear you.
Yeah, there we go. I'm
There we
just
go.
see my screen there?
Yeah,
All right,
great.
fantastic. Thanks, everybody. Appreciate it. I'm David Scarce with the Standard. I'm here to talk about the life and disability products the Standard offers OEB members. The Standard's pleased to partner with OEB to provide optional life, optional accidental death and dismemberment, short-term disability and long-term disability insurance. Starting with the basics, why is insurance necessary? Life insurance is designed to help provide financial support and stability to a family should a loved one pass away. Accidental death and dismemberment provides an extra layer of protection if the employee dies or becomes dismembered in an accident. And I've also got a few things listed on this slide that just kind of show the common things that are used to, that are supported by life insurance should a member pass away. So let's talk about the optional life insurance. So for the employee, optional life insurance can be elected in increments of $10,000 up to $500,000. There's a guarantee issue amount of $200,000 if the employee is electing the coverage when first eligible. So if they are a new hire, or if your employer is offering you optional life insurance for the first time during this enrollment period, you can enroll in optional life insurance up to $200,000 at guarantee issue. And what that means is that you can elect coverage without having to provide proof of insurability. You don't have to fill out a medical history statement. Also, during annual enrollment, if you're currently enrolled in optional life insurance, you can increase by $20,000 until you get up to that $200,000 level. So each year annually, if you're at 160,000, you can go up to 180,000 this year. You could go up to another 20,000 next year to get yourself up to 200,000, and you can do that annually without having to provide proof of insurability. There's also optional life insurance available for spouse and child. The caveat on this is that you must have optional life insurance for yourself as the member before you can elect optional life insurance for your spouse. For the spouse, you can elect coverage amounts similar to what you have with the employee, which is $10,000 increments up to $500,000. There's a guarantee issue level of $30,000 when electing coverage for the spouse when first eligible. So again, that goes back to, are you electing this coverage as a new hire? Or is this the first time it's being offered to you by your employer? Then you can get coverage for your spouse at $30,000. Anything above that $30,000 requires evidence of insurability. If you are wanting to elect spouse coverage this annual enrollment and you had not elected it previously but were eligible to do it, you can elect it during this annual enrollment, but again, it's going to require proof of insurability. For the child amount, there's increments of $2,000 up to $10,000 that you can elect during annual enrollments, and that's all offered at guarantee issue. No proof of insurability is required for that. We also offer optional accidental death and dismemberment. So this is layered on top of optional life insurance. So if, for example, you elected $100,000 of optional life insurance, you could also elect $100,000 of optional AD&D if you wanted to have a matching amount. The amounts do not have to match. You can have greater amounts or lesser amounts of optional AD&D than you do with your optional life. Optional accidental death and dismemberment does not require any type of proof of insurability. You can elect any amount you want during annual enrollment up to $500,000 for both yourself as the member and the spouse. And the child amounts are up to $10,000. Some added features here are going to be that with the life insurance, we have waiver of premium, which means that should you become disabled and unable to work, your life insurance can continue without you having to pay premium for it. There's also an accelerated benefits provision that says if you have a terminal condition and you're expected to pass away within 12 months, you can actually access a portion of your life insurance benefit before you die, with the remainder of those benefits being paid out after death. Portability and conversion means that should you leave employment, you can take your coverage with you. There's also a couple of value-added features, our travel assistance and life services toolkit, that come free of charge because you're enrolled in life insurance. So whether that's the basic life insurance that your employer might pay for, or the optional life insurance that you are paying for, if you're enrolled in either of those plans, you have access to our travel assistance, which provides coverage to members and your immediate family members when you're traveling more than 100 miles from home. So if you were to be traveling abroad and you lost your passport, travel assistance can help you with the replacement. If you are traveling domestically or internationally and you lose a prescription or run out of a prescription, travel assistance can help you find a pharmacy to get that prescription filled. If you are needing medical evacuation services, travel assistance can help you with that as well. So again, this is a service that's available to you simply because you're enrolled in life insurance. The other service, if you're enrolled in life insurance, is our Life Services Toolkit, which provides benefits to both members and beneficiaries. For the member, some important tools is that there is a will template that can help you create a will at no cost. So if you do not have a will, you can log on to our website, gather information from the Life Services Toolkit, create your own will, and there you go. You've got yourself a will now. There's also some estate planning tools, some funeral arrangement tools available to you as well through our Life Services Toolkit. And then with regard to disability insurance, very similar to life insurance, why do you need disability insurance? Because you're wanting to protect your income should you become disabled and unable to work. There's a lot of of expenses that you have that you're counting on your income, and if you don't have that, you don't have any other form of income to pay for it while you're not working. So that's why you enroll in disability insurance. Long-term disability insurance is insurance that's going to protect you if you're off of work for more than 90 days. So depending on the offering that your employer may provide to you, there's varying benefit percentages, there's varying benefit amounts. Like I said, the benefit waiting period is 90 days, which is the period of time you have to be off of work before benefits become payable. And the maximum benefit period is going to be to age 65 or your normal Social Security retirement age. For short, with the voluntary long-term disability, if this is your first time eligible, you can elect voluntary long-term disability with no questions asked. If you have been offered this coverage in the past but did not enroll, but now you're wanting to enroll enroll in it for the first time, you can do that, but you do have to provide proof of insurability, just like the life insurance. And if that proof of insurability is approved, then you have the coverage. With short-term disability, this is going to be benefits that are payable to you after only 7 days of missing work. And this again is going to be dependent upon what's being made available to you by your employer. So there are varying benefit percentages. You have a maximum weekly benefit of $1,500. You have a maximum benefit period of 90 days, which is going to be the maximum length that benefits are payable. But one thing to keep in mind is Paid Leave Oregon. With Paid Leave Oregon, the benefits that you're going to receive under that plan are going to be greater than you're going to receive under short-term disability. And unless you are ineligible for Paid Leave Oregon benefits, your short-term disability benefits are reduced by any amount you're entitled to receive under Paid Leave Oregon. And that is true even if you don't apply for the Paid Leave Oregon benefits. We get a lot of questions asked, hey, I want to take my short-term disability benefits now for my first 90 days, and then I want to take my Paid Leave Oregon benefits after that. It doesn't work that way. The Paid Leave Oregon benefit is considered a primary benefit, and if you're eligible for it, your short-term disability benefit is reduced. If you have exhausted your Paid Leave Oregon benefits, for example, if you went out on a maternity leave you exhausted your paid leave organ benefits after 12 weeks, return to work, within a couple of months, you get involved in a car accident and you have to be off of work again. At that point, you're not going to be eligible for paid leave organ benefits for 12 months. So therefore, your short-term disability benefit's going to pay you the maximum benefit payable. With short-term disability, because it's voluntary, you can elect it at any time. If you had the option to elect it previously but did not, there is a late enrollment penalty. So if you elect short-term disability now and you had the option to elect it last year but you chose not to, should you have to file a claim with the first 12 months because of an illness or pregnancy, your benefit waiting period, instead of being 7 days, is 60 days. However, if you became disabled from an accident, this late enrollment penalty does not apply. All right, in closing, if you want more information about the life insurance plans or the disability plans offered by the Standard, please visit our website at www.standard.com/mybenefits/OEBB. There you're going to find all kinds of information regarding life insurance plans, needs estimators and premium calculators, as well as our decision support tool, which walks you through the coverages and helps you make informed decisions about the insurance that's right for you. I hope you found this information helpful, and I look forward to having any questions that you may have.
Thanks so much, David. We will now move into the question answer portion. And so, are there any OEB staff monitoring the questions that might be able to bring something, or foreseeing any patterns or questions that we'd like to bring out to the group, or for any of the carriers?
Hi, this is Jackie. I was making notes along the way of some questions that that I couldn't answer, so I'll ask the carriers to answer them. David from the Standard, since you were just on, if you could come on back, there was a question about
Sure.
how does portability of life insurance work? If somebody wants to make sure that they can keep that after they no longer have it through their active employment, what do they do?
Right. So it's just an application that you have to fill out and return to the Standard within 31 days of employment termination. What it does is it allows you to elect any amount up to the amount that you had as an active employee. So if you had, let's just say you had $100,000 of coverage, you can say, I want to continue that $100,000 of coverage. There's a portability application you fill out, you send into the Standard. There's not any medical underwriting. If you want it and want to pay the premium, you will be approved for it. And then going forward, you simply pay the premium directly to the Standard for that coverage.
And the premium is different than what they were paying as an active, correct?
It is going to be slightly different. The rates that OEB has obviously are very competitive rates for a large group, but they still are group rates. So they are going to be much less expensive than, for example, converting to a whole life policy or something like that.
Okay, great. And there was one of the slides mentioned up to age 65 or Social Security graded age. And we got the question, what does Social Security graded age mean?
Sure. Yeah, well, I fall into that Social Security normal retirement age. Based on your date of birth, Social Security has dates that say, okay, it used to be everybody got Social Security at 65. Well, folks that were born after 1962, I believe it was, your Social Security retirement age is 67. So it's kind of based on what your normal Social Security retirement age is. So it's either going to be 65, or it could be 67, it could be 68. Again, it's based on your date of birth.
Excellent, thank
And
you for answering
there actually
those.
is there actually is a little table within the certificate of insurance that can be found on the OEB microsite that tells you, hey, if you become disabled at this age, here's how long you'll get benefits for.
Okay, great. Thank you.
Sure.
We had a question for Kaiser Permanente. I don't know if I know there was some background noise with the Kaiser rep, so I'm not sure if they're available now to answer questions.
Hi there.
Oh, excellent.
Sorry about that.
Okay, so the question.
So it looks like re-enroll for the class pass. So each year on the self-care apps, you'll just re-enroll through the same site, self-care apps on kp.org, and it'll continue that free access.
Okay, your audio was a little in and out there, so I'll repeat the question because I see that it was typed into the chat. It said, if we have ClassPass last year via Kaiser, do we need to re-enroll with ClassPass, or will that automatically update and roll over with, if so this person is changing from one Kaiser plan to another, from plan 2A to 2B. And so was your answer that yes, it would roll forward, or no? I didn't quite catch that.
So just because you switch plans, it doesn't change anything. The only time you re-enroll is every year when it's about to expire or it expires, because it'll come back and you have to re-enroll with your kp.org app or online, but not because you switch from plans. So when your year comes up, then that's when you would need to re-enroll.
Okay, great. And then while we have you, there was another question a while back while you were presenting. There was a benefit that said services for dependents are limited to 10 office visits, 10 lab and x-ray, excluding specialty scans, and 10 prescription drug fills per year. This member typed in and said, I called member services and they said there's no limit. Linda kind of chimed in and clarified that the limits are on out of area dependents, people who are outside the Kaiser area. So maybe you could explain out of area dependents a little and how that all works.
I'm so sorry, can you hear me that? Hold on just a second. So the question is regarding so that's in itself, I'm gonna be honest with you, I can give you, what I could do is provide a flyer. I can put that in there as a handout, or I can give that to you, because it all depends. And so I don't want to give you guys the wrong information. So I could provide that information to you either separately or put it in the handouts here on the chat in regards to it, because it just all depends. There's a couple different areas. And then in regards to primary care providers in Monmouth or Corvallis, I'm just looking at the questions. If there is area in Salem and Lane County, we do have affiliated providers around those areas. And I can also provide that information on the chat, or I can direct you to the OEBB microsite that we have that gives out all that information, and even including the dependent care for folks that are going to college and things like that.
That would be great if you could put something in the chat, and then if there are handouts that you think people would find helpful, maybe you can provide those to our communications team and they could put those on our website for everybody to access if they want them.
Absolutely, I'll do that right now.
Great. So another question was for Moda. Do we have Alina?
I'm right here.
Okay, great. There's a question about mental health apps, and this member, I guess it's, well, I should have asked while Kaiser was on the line too, but you can both answer. This member is interested in mental health apps for themselves and their dependents. And so one question was, can dependents access these apps if they're enrolled in the medical plan? And are there any age restrictions, like if the child's under a certain age, are they not able to access the app? So could you talk a little about your mental health resources?
Did you want Kaiser or Moda to go first?
Alina, since I've got you, go ahead.
Okay, so into comparison with Kaiser's, like the Calm app and all that stuff, Moda does not have those apps. However, we do have our member dashboard, and in that we have our Sprout platform, which has different exercises, videos, and articles relating to mental health, depression, anxiety, that you can then utilize in the member dashboard. When you go into the member dashboard, we have a bunch of different mental health programs that are kind of app-related, one of them being our Maru Health program that helps with depression and anxiety and burnout. And so with that program, they actually send you a device that tracks your psychological response to stress. When they do that, you take your stress levels, they create self-guided techniques to help with depression and anxiety. And as you take the program, you should start to see that your stress level starts to decrease. In addition, we also have Active and Fit Direct, which provides gym membership discounts. And then with the Active Fit and Direct, there are on-demand videos that you can do exercises from the comfort of your home, and that's at a discounted rate. Again, all of that is through your member dashboard.
Great. You tackled another question I was about to ask you, which is, do you offer gym membership discounts? So that's great. So
And then
as far as
Kaiser,
oh yes,
I'll
please
just jump in. Yeah, so our self-care apps are for whoever is a member. So that includes family. Now, some apps, they may be, depends on how old you are. So I believe Headspace could be 18 or over, 16 and over. So we have to look at the self-care app itself, but it is free of cost for anybody that is a member. So that includes your family. And as far as reduced rates, we have also CHP Active, and we have discount programs as well for even travel, for gym memberships, gym equipment, or even watches. What do you call it, like Fitbits and things like that.
Excellent, thank you. So back to Alina, when what did you call it? The member, it's not a member portal. What did you call it? Member dashboard?
Yeah.
So for the member dashboard, does each dependent kind of make their own profile as on the member dashboard? Would they each be able to log in separately and use those things individually?
Yes, it would be 18 and over to be able to create a member dashboard.
Okay, so then it sounds like a lot of these mental health benefits are pretty much available to adult or close to adult age, like either 16 or 18 and up. Do you have any recommendations for if a member has a child younger than that needs mental health services? How would they access those?
Yeah, I would recommend them calling our behavioral health champion team and then telling them what they're looking for, and they can assist the member in finding the right resources available to them.
Okay, great. And Kaiser, you have similar answer?
Yes, and I apologize for the background noise again. Yes, so we have a whole, I'll send the flyer as well to Mental Health Wheel, and we have a behavioral health team, and they can assist you as your primary care too. You don't need a referral, obviously, from your primary care, even for our young children or whatnot, but there is care for any age. But we do have a phone number, and I can send that information to you.
Great, thank you. That covered everything I had written down. Linda, have you caught any that you want to ask?
Hi, everybody. I know people are really asking about the gym member discount. Elena, could you explain anything about the membership for gym discounts with MODA?
Yeah, of course. So as an OEBB medical or dental member, you have access to Active and Fit Direct, which provides a gym membership discount for those participating in that program. So you log into your member dashboard, you would enter your zip code, and it's going to list all the gyms that are participating in Active and Fit, and they would provide that gym at a discounted rate than what you would do if you were to go direct. Active Fit also provides nominations. So if your gym is not part of that program, you can actually nominate your gym as one of the facility to see if they would like to participate in that program. And then in addition, there is that demand like exercise classes that you can do in the comfort of your home through Active and Fit.
Thanks, Elena. We have somebody asking if Planet Fitness is covered.
You would have to go into your member dashboard. I can go offline, see if that is, but if you logged into your member dashboard, enter your zip code, it would list Planet Fitness, then you would know it's covered.
Thank you. I'm not seeing any other questions. I think, Jackie, you kind of nabbed all of them. So I think if anybody has any other questions, let's try to get them in right now.
Linda, this is April. I do see one in here for MODA.
Okay.
If you're available, Lena. It's about how or when do we use Teladoc for PCP 360 coordinated care? How does that work?
Okay, I'm unmuted now. So Teladoc is not effective until 10/1, 2024. So you would have to wait until the new plan year too. But then once you are effective, then you can visit their website and then you can register through their website for those Teladoc appointments. And then if you want to select them as your PCP 360, it's the same way that you would today. You would go into your member dashboard, select Teladoc, and then you'll start getting that better benefit. But Teladoc normally has, you know, their own app, their own website, their own phone number. And so effective 10/1, you'll just be able to work with that Teladoc provider.
Great, thank you.
So here's a question for both MODA and Kaiser. So we'll let MODA go first and then Kaiser. After a member's family out-of-pocket maximum is reached, are there any limits to how much Kaiser or MODA will cover for prescriptions?
So for MODA, once your out-of-pocket maximum is met, all medical and pharmacy cost is covered at 100%.
And that would be the same for Kaiser.
Thank you. What about co-pays for Teladoc appointments?
So for Teladoc primary care, it is your virtual visit cost sharing. So for those on plans 1 through 5, it's just a $10 copay. And then for those on 6 and 7, it's after your deductible has been met.
We do have a question coming in asking about massage therapy services. Maybe both Kaiser and MODA could address what they cover in that realm.
So yes, with Kaiser, you have, so the plans, you do have self-referred acupuncture, chiropractic, naturopathic services. And so you can go through our CHP group, Healthy. Let me actually pull up your account here because I want to make sure I get this. So for plans 1, 2A, and 2B, you'll have for chiropractic, so it looks like you have chiropractic and acupuncture, self-referred alternative care there. And that's a 20 visit limit for chiropractor, 12 visit limit for acupuncture through the year. Now, massage therapy isn't in there. However, you can get reduced rates through our discount programs like Active. We have Choose Healthy, and also, and I'll add that information as well when I send it to Sarah. But there are deals on that end. So, and as far as, I forgot to mention this, we do also have Active and Fit Direct, and so we do have different participating gyms where you can get reduced rates like LA Fitness, Gold's Gym, Curve. Well, I don't know if Curve's around here anymore, but Anytime Fitness, and I believe I saw Planet fitness as well. So that's the Choose Healthy program.
And then for MODA, massage therapy is not a covered benefit, but you do have access to acupuncture, chiropractic, naturopathic. And for acupuncture and spinal manipulation, so chiropractic, you do have a 12 visit limit combined annually for those services. But just like Kaiser, if you log into your member dashboard, we have Choose Healthy, which just provides discounts. So if you're looking for a massage therapist, it would provide you discounts for that massage, and then other discounts like for your Fitbit, if you're looking for a Vitamin X blender. So it just has all these different resources and discounts that may not be part of your health benefit.
Thank you, Alina. There's another question that's MODA related. If someone's a new hire and they want to choose a PCP 360 or look on the website to find if there is someone in their area, if they're not a member yet because they're new, can you tell them how they go about that?
Yeah, of course. So we have a OEB customized MODA website. It's modahealth.com/OEBB. On there, we have MODA's online provider directory tool known as Find Care. So you would click on Find Care. Connexus is your network. From the type drop-down menu, you would select PCP 360. Enter your zip code or the provider that you, if you know the provider's name. But if you enter your zip code, it's going to list all the PCP 360 providers in our network with this 360 icon badge.
Excellent, thank you.
Mm-hmm.
Oh, there's a question here about how do I find out what I'm going to pay out of my paycheck for the plans that I choose? And that is, you have to go to your employer. Every employer is different. They offer different plans, they contribute different amounts. So the amount that you will pay for your coverage has to come from your employer. Oh, here's a system question. That's my area now. So when you go into oebenroll.com and you want to consider whether you want to change plans or not, the question is, will I be able to see what I currently have before I have to make a choice for something different? And yes, you will. When you log in, it'll show you what you're currently enrolled in, and then you'll have the opportunity to click a button to change it if you wish. There's a question, I think it's tagged onto the provider question, how to find a provider. Under MODA, there's a question that says, does it do that for dentists too? So I think that's, you're not only looking for a PCP medical provider, but if you're looking for a dental provider, is that the same process?
Yes, you would use MODA's online provider directory, Find Care, but you would then select the applicable network. So you, depending on what plan you choose, you either are selecting the Premier network or the PPO network, and then you would then just enter, your zip code, and then it's going to list all the providers in each of those networks.
Okay, great. And there was a question about the end of life kits, which I believe came from David at the Standard. So David, do you want to kind of recap what that's about?
I'm sorry, what was the question again?
They mentioned an end of life kit, but I think you had mentioned that you could prepare
Life
a
Services
will.
Toolkit, perhaps.
There you go.
That's what they're talking about, Life Services. Yeah, so the Life Services Toolkit, and there's a flyer for this out there on the OEB microsite, but it's it provides services to employees while they're living, and it provides services to beneficiaries should the employee pass away. But the services that are provided to the employees, kind of the big financial planning tool services, that there's a will template online. So if someone doesn't have a will, they can go online and create a will at no charge, and so now they'll have a will. There are also some financial planning tools, some funeral planning arrangement tools, things like that that are available. There's just a flyer that you go download. There's a little website that you go to, and you can have all these tools available to you.
Excellent, thank you.
Okay, so it sounds like we're kind of wrapping up the questions. I do see that it looks like a couple just came through. I see one about, could you please tell a little more about the dental plan? If I want to, I'm not quite sure what that question is asking. If I want to talk to my dentist. Is anyone else monitoring the questions understand that question? Could help me out?
Sarah, I'm a little confused on that one also, but what you might want to do is call our benefits line that is on your open enrollment material and maybe talk to somebody personally about your dental plan. That might, they might be able to more personally assist you with your questions about dental.
Great, great suggestion, Linda. Thank you. Let's see. It looks like we are wrapping up in the questions area. Let's see. So we did just want to say, oops, sorry.
Sorry to interrupt, Sarah, but there's a question which is kind of asked, I think it's for Mona. And the question was, if they've paid out of pocket for something, but it really should have been covered by their insurance and they want to submit a claim for reimbursement, is there a window of time that could it possibly be too late for them to send that in? This person is saying that they paid at the end of December. Is it too late now to try to get some money back reimbursed from the insurance? Doesn't necessarily say what the claim is for, but maybe all claims are the same.
Yeah, I would call our health navigator team to confirm, so they can look at your data service and confirm if you are in that window. Normally, I believe that claims filing is about 12 months, but it could differ between, different plans. So I would just call the health navigator and then they'll be able to help you out with that.
So there's a question about which plan is better under a certain circumstance, and I think that's a good opportunity. Sarah, can you bring back that slide about the plan comparison tool?
Yes. Close your eyes while I zoom backwards. Okay, there we are. So if you want to go to the online plan comparison tool at compareoebplans.com, then you can select just dental, and you can compare across and you can look at implants or bridges or whatever specific service you're looking at, and then you can get it across the board look at it.
Thank you. That seems great. Just to reiterate for people, the recording will be emailed out, so everyone who registered for the webinar will get a link to the recording. And we're also posting it to the website, I believe, so even people who didn't register or didn't tune in today can still get access.
Correct. We will be emailing out follow-up emails with the recording link, and then also we'll be posting it on the website on our YouTube, and we'll have the closed captioning that will be next week when it has the closed caption added. Let's see, I'm seeing a question in here about long-term disability, and okay, I see it just got answered by Linda, so I will, it's not a broad generic question, so I won't bring that one to the group. Okay, do we see any more questions that we need to address? It looks like we've got it pretty closed out. Again, let me close your eyes while I zoom back to the end. If you have any questions, you can send emails to oebbenefits@odhsoha.oregon.gov, and you can give us a phone call at the number listed. You can also go to oebinfo.com, and it'll have this recording next week, and also all the materials that we went through and links to those. And so if we don't have any more questions, we will go ahead and wrap it up for today. And thank you everyone so much for joining this, and we hope you found it very helpful, and you will be receiving your email shortly. Thanks everyone.
Thank you.
Thanks.
Thank you.
Thank you.